My name is Peter Borbas, and I'm here to talk to you about Lyme disease, and particularly chronic Lyme disease. I have an incredible amount of experience with it, having it myself a couple of times. 2 daughters with it, one for about 15 years, one for about 12 years or so, very significantly. When she was 15, going to be a sophomore in high school, and she developed a sore throat, and it got worse, and our family practitioner sent us to a specialist in ENT, and the sore throat developed into a headache, which was just around the clock, 24 hours a day, 7 days a week. Other pain developed in her body, her joints, her muscles, fatigue. She developed this hearing sensitivity. She couldn't have any sound around her. She ended up, after numerous doctors and clinics, and she ended up in the headache department of a major hospital on the East Coast. And after maybe about a year or so, a number of hospitalizations, they came to me and said, "Mr. Borbas, we've never seen anything like this before. We don't know what to do." Her illness just got worse, and it was about 14 months after first developing a sore throat that we finally did get to a Lyme-Literate doctor. And that doctor used a test that was different than the ELISA test. And the doctor used a Western Blot test, and the Western Blot has a higher sensitivity, and it was able to identify that my daughter had Lyme, where the other tests and the other doctors could not identify that. So by that time, 14 months of having Lyme go through her body and whatnot, it actually passed into her central nervous system, the brain. And it created all kinds of havoc. Just incredible mood swings. I remember her anxiety, the racing heart, rushing her to the emergency room because we thought she was having a heart attack. She received treatment, antibiotic treatment, and you know, there's a lot of different kinds of treatments, the length of treatment, the types of antibiotics that are available. A lot of people, their bodies may reject some types of antibiotics, or the antibiotics don't have any effect on them. But you know, a lot of damage had really been done already to her body and her brain, and she continued to have headaches for a long period of time. At one point, sometime later, maybe some years later, she went back for more testing on Lyme. They couldn't find Lyme in her, but that doesn't mean that a person who doesn't test positive or has positive indicators for Lyme doesn't have Lyme. There's been a lot of therapy, pain management clinics and hospitals and doctors to help her with her pain. The pain persisted even though there was no Lyme in her. So it's almost kind of like being in an auto accident in a way. The accident happened, it causes damage, and then you have these lingering symptoms for years later. I'm happy to say that 12 years later, she's on a road to recovery, where for about 11 of those years we never saw any kind of happiness, no smile, no hope. You know, at one point she just wanted to be dead so that she didn't have to live in the pain anymore. And that was the driving force that brought me to this place that I've been for a number of years trying to make the public aware of Lyme, chronic Lyme, the problems that we have with diagnosis, misdiagnosis, treatment, mistreatment. When I first came down with Lyme, it was very flu-like. We hear that that's typical. I never had a bullseye rash or any rash that I knew of, both times when I had Lyme. My daughters, we never saw bullseye rash with them. My mother, who we think picked up a tick on a couch, she had achiness. She never saw any bullseye rash, any kind of rash. My younger daughter had a swollen knee. We thought it was in a soccer game. My older daughter developed a sore throat, then went to a headache. Then there was sensitivity in her hearing. a racing heart, mood swings, anxiety, just an incredible amount of joint and muscle pain. Those are some of the main symptoms. Certainly there are a lot of others. The classic is we think it's people who are walking in the woods and forested areas, and ticks are living under leaves, and they're carried by rodents and birds and other animals. And you take the case of my mother, who lives in the curb-lined subdivision, you know, nice colonial house, pristine, clean. The cleaner's coming in, and the place is always vacuumed and spotless, etc. But she's got a slew of grandchildren, and they're constantly in and out of the house. And it's nothing for somebody who's been outside in the yard, even manicured lawns, to walk in, have a tick on them, deposit it on the carpet, deposit it in the furniture, and then get on to somebody who traditionally wouldn't be walking in that environment. And once we had a client tell us that they had come in from they live on the West Coast. They came into an East Coast airport, they rented a car, and they saw something moving on the passenger. They had tan-colored seats, or light tan-colored seats. They saw something moving on the seat, stopped to examine it, and brought it in, and sure enough, it was a black-legged tick. So if a person from Los Angeles went back and had come down with Lyme disease, they're not used to diagnosing Lyme disease. We saw this with somebody from Ohio who came out and visited for a holiday one time. And they too, I believe, had picked up a tick here. Could have been in the furniture, could have been in somebody's yard. Went back to Ohio and they had a very difficult time diagnosing the Lyme. But I think big carriers are our animals. We don't think about that. Our own bodies. I could be sitting here in this chair right now. I don't know who sat in the chair before me. There's a carpet under my feet. I don't know what's crawling on my shoes right now, up my legs. I don't know where this carpet's been and who's been on it. Now, the Lyme is a unique disease. It's not that well understood. There's a lot of confusion, misunderstanding. We don't know really a lot about it. It's difficult to identify, and there's no test for Lyme that's a pass-fail. Yes, you have it. No, you don't. So it becomes a clinical diagnosis. So you've got to have a doctor that understands the symptoms. We'll take a look at your history, the type of person you are, what other things have happened in your life, that kind of thing. Lyme-Literate doctors, infectious disease doctors will treat this disease for a much longer period. They want to make sure that they cover the life cycles of the disease. Get on the web, start doing search. Don't leave any stone unturned. Go to every doctor you possibly can think of. I want to encourage people. I wish I could mandate it, that they get to a Lyme-Literate doctor immediately, that they don't wait.